Hello, welcome to my channel Metachondria, where I'll be teaching you how to treat metabolic diseases like diabetes, hypertension, and dyslipidemia very precisely. In this video, I'll be telling you how to take history in a patient with diabetes mellitus. If you see, right, like in our day-to-day OPD, we don't take elaborative history of a diabetic patient. But this is very, very important. The reason being, if you see the pioneers of diabetic treatment, like American Diabetes Association, etc., they are moving more towards personalized medicine and integrated medicine. Personalized medicine means you will be treating the patient according to how much income of the patient, the education status of the patient, how much time the patient is available for exercise, etc., and the stress level. So you will consider all these things and then you give the personalized treatment. Integrated means there will be diabetes educator, there will be podiatrist, there will be diabetologist, and there will be nutritionist. There will be multiple members and they everyone together will treat a patient. Personalized medicine and integrated medicine is the future of diabetes. That is the state of art of treatment of diabetes. So that is why taking a elaborative history in a diabetic patients becomes very, very important. In this lecture, we will learn how to take a history. What are the important points that you need to ask in a diabetic patient? Okay, so first thing is the education. Education is always, always important. For example, if there is a patient who is illiterate, and there are two patients, one patient is illiterate, one patient is a literate patient. One patient has finished his graduation, one patient is illiterate. Imagine both of these patients are on insulin. Now, whom do you think, which patient is easy to manage? Like, in which patient you can actually educate how to take the insulin, how to monitor the blood glucose levels, how to titrate insulin levels according to blood glucose? In which patient that will be easier? Definitely in the educated patient, right? So, diabetes education will be easy in the patient who is educated rather than illiterate. Then second is the income. So this is very, very important factor. Normally what you can try is only 2 to 3% of the per capita income should be invested in diabetic treatment. So imagine a family, husband is earning 50,000 and wife is earning 50,000. Their annual income will be 12 lakh. Okay. Now imagine they have two kids. So the family will be of 4 and their family per capita annual income will be around 3 lakhs. Okay. So 3 lakhs. So on per person they can invest 3 lakhs. So 2 to 3% of this will be 6,000 to 9,000. So if the patient's per capita income is 3 lakh, you should ensure that you are treating their annual cost of diabetes treatment along with investigations I am seeing is between 6,000 to 9,000. If you increase more than this, there are high chances that the patient will stop coming to you and they will find alternative doctor. So income is very important. The diabetic treatment and investigation cost should not be more than 3% of their per capita income. Then chief complaints. If the patient has any chief complaints, you can actually write it. Then diabetic history. This is the very important part. Diabetic history can be divided into 3 things. So one, you will be asking symptoms related to diabetes. Then you will be asking the symptoms related to complications of diabetes. Then third, you will be asking symptoms related to other associated conditions. Now, what are the symptoms related to diabetes? So you should ask in every visit if the patient has polyuria, if the patient has polydipsia, right? Frequent urination, polydipsia. and if the patient has polyphagia. Then nocturia. Is the patient waking up every often at night to pass urine? You should ask these things. Then complications related to. If there are high sugar levels, the patient might have urinary tract infection. So if there is any burning micturition, you should ask some such symptoms. Then in females, right, uncontrolled diabetes, they might have vaginitis. So you should ask if they have any burning sensation or itching or any infection in the vagina. Should ask this for the symptoms of vaginitis. Then they might also tell you blurring of vision. What happens when the glucose levels are high? The lens which we have, it accumulates more water. The water content in the lens alters. And this can lead to blurring of vision. Then you need to ask them associated conditions also. If the patient only has diabetes or patient also has hypertension. If the patient has dyslipidemia or hypercholesterolemia. Okay. If the patient has any history of heart disease. And if you're thinking in terms of type 1 diabetes mellitus, you should ask the patient of history of any thyroid disease or any autoimmune disease. Okay. So this is about the diabetic history symptoms. So first you should ask symptoms related to the diabetes mellitus, which are polyuria, polydipsia, polyphagia, nocturia. Then you will ask about the complications, which is urinary tract infection. In females, you can ask about vaginal infections, vaginitis. You can ask if there is blurring of vision. The water content in the lens alters, because of which they will have blurring of vision. So with good glycemic control, this is reversible. Then you should also ask about the associated conditions, like if they have hypertension, diabetes, heart disease, thyroid disease, or autoimmune disease. Okay. So now next, you have asked about the symptoms. Now you should ask about the medication. So first, you should ask what medications they are on. Okay. Then you should ask about the compliance. If they are taking it regularly or not. Then you should ask episodes of hypoglycemia with those medications, especially if the patient is on insulin. Insulin, sulfonylureas like glimepiride, these are the two medications which can cause hypoglycemia. If the patient is on these, you should always ask. Symptoms of hypoglycemia. Okay. Then, are they facing any side effects? They might have some side effects, maybe hypoglycemia. One of the major side effects may be hypoglycemia or weight gain or weight loss. Some SGLT2 inhibitors have the side effect, they might have recurrent urinary tract infection. So you should ask about the tolerability of the medicines. Then you should ask if they are taking any alternative medications. These are the important things, that in what medications they are on, how are they compliant or not, do they have any episodes of hypoglycemia, are they having any side effects due to the medications, and are they using any alternative medications. These are the important things. Then past medical history, if they have any other disease apart from diabetes, okay, if they have heart disease, asthma, or anything, any other disease, just make a note and just note down what medications they are on. Then family history. In family history, so first is the history of diabetes in first degree relatives. This helps you. There is one video called as maturity onset diabetes in young, right? Classification of diabetes. In that, I have told that In this, family history is always present. So if the family history is not there, you can easily rule out that the patient does not have MODY. And in type 1 and 2, it can or cannot be there, because see, diabetes is so common in India that accidentally also they like, it's very common that the parents might have diabetes. So you should ask history of diabetes in first degree relatives. Then if you're thinking if there is a young patient, right, 30-year-old patient who has high sugar levels, and you are thinking in terms of type 1 diabetes mellitus, right, there you ask the parents have diabetes, so you cannot rule out MODY, and you can type 1 and MODY. Now, next thing that you need to ask is if there is any history of autoimmune diseases in family, thyroid disease or any autoimmune disease in the family members. This will be very important if you are thinking in terms of type 1 diabetes mellitus. But if you are very sure that it's a type 2, then you can skip this. Then history of atherosclerotic cardiovascular disease in the family members. This will give you a count on how much is the how strictly you should manage the patient glucose levels. Right? If there is a history of heart disease in the family, it means that the patient is also prone to have heart disease. And because diabetes is atherogenic, you need to ensure that the diabetes comes under control. This is about the family history. Then personal history. This is very important in terms of diabetes. Two histories that are very important in diabetes is, one is the diabetic history, where you ask for the symptoms and the medications. Then is the personal history. So first you will ask about the diet. What is the importance if the patient is a vegetarian? So diabetic patients are started on metformin, right? Metformin, one of the side effects of metformin is it can cause megaloblastic anemia. It can decrease the B12 levels if the patient is on metformin. So you should be very careful if whenever you're adding, not like you should be very cautious when you're adding metformin in a vegetarian patient, because the patient is more prone to develop megaloblastic anemia. Then if the patient has mixed diet, you should actually see the calorie intake, right? The red meat, they are all atherogenic, they are all like, they increase the insulin resistance. So this is the risk factor for diabetes. Then appetite. What happens in diabetes mellitus? There is autonomic neuropathy. This autonomic neuropathy causes gastroparesis. There is decreased gastric motility. There is gastroparesis and there is decreased gastric motility. This decreased gastric motility, what happens, because there is the motility is decreased, the patient always feels full, and therefore their appetite is reduced. I assume like it's very common that diabetic patients say that, doctor, like I don't feel hungry. I'm not feeling hungry. Even if I eat very little at night, I don't feel hungry. This is because of the gastroparesis. Then next thing that they will ask is the bowel movements and bladder movements. Same. The reason is same. They will be having autonomic neuropathy and these movements might be altered. Stress, sleep. You should ask the stress level. How much is the stress level for the patient? How is the sleep of the patient? And then exercise. Every day, 150 minutes per week. Patients should perform exercise for at least 150 minutes per week. So you should ask if the patient's lifestyle is sedentary, are they performing any exercises, because you will have to modify these risk factors also. Sedentary lifestyle is one of the modifiable risk factor for diabetes, therefore you will have to ask this. Then tobacco, alcohol. Both of these are what? They are atherogenic. They are atherogenic. So you should ask if the patient is having alcohol, tobacco, you should counsel the patient that he or she should quit it. So these are the important things. See, if you say this, you feel it's very elaborative. What you can do in your outpatient clinic is have a pro forma, pre-written pro forma for diabetic patient, Whenever a diabetes patient is coming for follow up, you can use that same proforma and just check the boxes. That will be useful for you. That's it from my side, and good luck.